Welcome back to part 2 for the urinalysis lecture for MLT 110. The first thing that we need to discuss is the physical examination of urine. The very first thing as a lab tech you need to look at for a urine sample is the color of the urine. Different colors of urine can mean different problems with a patient. Next, you need to look at the clarity or the transparency of the urine sample. Is it clear? Is it hazy? Is it cloudy? Or is it turbid? If a sample is hazy or cloudy or turbid, it could indicate a UTI infection in a patient. The next thing we need to measure as a lab tech is the specific gravity. This is a measure of density of the urine. A textbook definition for specific gravity is the ratio of weight of a solution to the weight of equal volumes of distilled water. There's several different options out there to measure specific gravity for urinalysis. There's an instrument called a refractometer, and there's also a urinometer. But these are not used a lot of times now in the hospital setting because the urinalysis strip that we use, the dipstick, can also measure specific gravity. This image shows what a refractometer looks like. This is the instrument that we can measure specific gravity on of urine. You would put a drop of urine on the lens, and then you would hold the refractometer up to the light, and there is a scale inside the refractometer where the urine would cause a line to go up to, and that would tell you the specific gravity for that urine sample. And there's a little lid that you would need to raise up, put your urine sample on. Here's the little lid, and here's the lab tech dropping the urine sample on, and then of course you would hold it up and read your sample. When you get to the urinalysis class, you should complete a refractometer lab. Here is an example of the unimometer. Again, this is used or can be used to measure specific gravity. This is a more old school method for measuring specific gravity. You would take this unimometer, it has this bulb and weight on it, and then the stem that you're going to actually complete your measurement on is at the top. You would put your urine into a graduated cylinder, and you would drop the unimometer down into the urine sample, and then wherever your urine sample shows up or lines up on the scale would be the specific gravity of your urine sample. Next, we need to talk about the chemical examination of urine. This is dealing with the dipstick that I mentioned a little bit earlier, and we will be working with the dipsticks a little bit more in class, and you'll be seeing an example in class, but on the next couple of slides we'll have an image of the dipstick so you'll know exactly what we're talking about. There's about 10 different tests that can be done on this one dipstick, and we're going to go over each test. Okay, the first test we're going to talk about on the urine dipstick is glucose. The presence of blood glucose on the dipstick can indicate that the blood glucose has exceeded the renal threshold. Remember earlier we were talking about what renal threshold is. That means that the blood glucose level has exceeded all that the body can hold, and the glucose is being excreted out into the urine. So this can occur in diabetes mellitus or gestational diabetes. This is an indication of uncontrolled diabetes. Glucose in the urine is called glycosuria. Another test on the urinalysis indicator strip is bilirubin. It's the primary bile pigment from the breakdown product of hemoglobin from old red blood cells. It can be found and be present in the urine when there's an indication of liver disease or bile obstruction or even hepatitis. Another test or pad on the indicator strip is ketones. Ketones are produced when the body burns fat rather than sugar for energy, and you would be positive for ketones when there's situations like uncontrolled diabetes, even starvation, or prolonged dieting or fasting. Ketones in the urine is called ketonuria. Next, there's a test pad on the indicator strip to test for blood. This can occur when there's infections in the body or bleeding in the kidneys, whether there's glomerular damage in the nephron, also tumors in the urinary tract or trauma from surgery, or even trauma from a catheter insertion can cause blood in your urine. You may have blood in the urine as a result of menstrual contamination. The presence of blood in urine is called hematuria or hemoglobinuria. The last test that we're going to talk about on this slide is pH. This measures the alkalinity or the acidity of urine. The normal pH of urine is 5.0 to 8.0 pH. Below 7.0 indicates that you have an acid urine, and above 7.0 indicates an alkaline urine. And whether it's high or low can be affected by diet, medications that you're taking, whether a patient has kidney disease or a metabolic disease such as diabetes. On this next slide, we're going to continue to talk about different test pads on the urinalysis indicator strip. The next test we're going to talk about is protein. Remember, you can have up to 10 tests on this indicator strip. So there's several more tests that we need to talk about. But protein is an important indicator of renal disease. It can be caused by an UTI or urinary tract infection, or after something like vigorous exercise. A positive urine protein is caused by albumin. Albumin is the protein that the test indicator strip is actually testing for. And albumin is the most abundant plasma protein that's found in the body. Increased protein in the urine is called proteinuria. The next test is urobilinogen, and it is a breakdown product of red blood cell degradation, and it is increased in patients with hepatic or hemolytic diseases. Everybody has a normal low concentration of urobilinogen, so the normal low concentration is usually at least 0.2 on the indicator strip, but if it's a higher reading than that for urobilinogen, then that would be considered abnormal. The next test is the nitrate test on the indicator strip. This is produced when there's a gram-negative bacteria in the urine sample, and it happens when nitrate is converted to nitrite, and this is a possible indication of a UTI infection. Okay, next up is the leukocyte esterase test. This test is going to show whether there's white blood cells in the urine, and this test is going to be looking for an enzyme that's primarily found in neutrophils. Neutrophils are white blood cells, or a type of white blood cells. This test is usually helpful when patients have some type of infection or inflammation in the urinary tract. The last test we're going to talk about is specific gravity, and we've already talked about it in depth, but it reflects the kidney's ability to concentrate urine. A normal adult or a hydrated adult, the range for specific gravity should be 1.010 to 1.025. On this slide, it's showing you exactly what a urinalysis test strip or a dipstick will look like. Each one of these pads on the dipstick represents a different test. So when you dip this dipstick down into the urine sample, it will be performing a different chemical test on the urinalysis sample. So out here to the side, it's talking about different possible indications of each of the tests, and we talked about some of those indications as we went through each of the tests on the previous two slides. The bottle that these dipsticks come in will have a scale on the side of the bottle, and you will see this in lab when we're together on campus. But the side of the bottle will have a scale that you will compare your dipstick to determine, based on color, what the test results are. You can read these dipsticks manually, looking at the side of the bottle or the scale on the side of the bottle, or we also have automated analyzers that you can stick these dipsticks in and it will read the test for you. Next, we need to talk about the microscopic examination of urine. Based on the results of the urine dipstick, if the results are abnormal, we may need to look at the sample under the microscope. The first thing we need to do in order to prepare the urine sample for microscopic examination is to spin the urine down in a centrifuge so that the cells and the particles in the urine can go to the bottom. Once the sample is spun down in the centrifuge, the liquid portion or the supernatant is poured off so that the sediment can be the portion that's examined underneath the microscope. Once the sample is on a slide under the scope, the lab tech can estimate ranges of components seen in the urine sample and report it out. The urine sediment can be viewed on a stained slide or an unstained slide. So what are the different components of urine sediment? What will you see when you look at urine under the microscope? The first possible thing that you might could see would be white blood cells or red blood cells. You may see a few of each type in a normal urine sample. If you were to see excessive amounts of blood cells, whether it's white blood cells or red blood cells in a urine sample, this would be considered abnormal and might be indicative of an infection or inflammation. Next up, you might see microorganisms in your urine specimen under the scope. These would be things like bacteria, yeast, or fungi. Next is protozoa. You can see different protozoa like Trichomonas vaginalis in urinary samples under the scope. Trichomonas vaginalis is a parasite of the urogenital tract, and it has a characteristic twitching movement. Next would be spermatozoa or sperm. Occasionally you can observe sperm in a urine sample. You would not only be able to see it in men sometimes, but you could see it in women as well if it's not been long since they have had sexual relations. The spermatozoa may be motile or non-motile, meaning that they could be moving or they could be still. You could see the characteristic oval head of the sperm and the tail of the sperm. The last thing we're going to talk about on this slide are casts, and casts are just an accumulation of proteins that are formed in the tubules of the nephrons. And there's several different types of casts that can be formed in the tubules. There's something known as the hyaline cast, the granular cast, the cellular cast, and the waxy cast. And we're not going to go a lot in depth of talking about these different types of cast in 110, but you will go more in depth when you get to the urinalysis course and learn the exact difference between these types of cast. Just know for now that it is an accumulation of proteins. Yep. Okay, now that we've talked about different components that you could possibly see inside of urine sediment in a urinalysis sample, let's actually look at some pictures of what some of those components might look like. So first up, we're going to look at what white blood cells look like under the microscope. So here are your white blood cells. They're round structures and they kind of have a grainy look to the inside of the structure or the cell. This slide is unstained, so it's going to be mostly clear. There's going to be no color because it's unstained. Here are different bacterias on the slide. This is a rod-shaped bacteria that the arrows are pointing to. These little small dots, These are the round bacteria, and another name for the rod-shaped bacteria are bacilli. This next image is showing you a cast. This is a Highland cast, and it's really clear because, again, this is a unstained slide that we're looking at for urinalysis. But this kind of long structure, and I'll outline it with the cursor here so you can see it. But you see kind of how it's a long, clear structure. Remember, that's an accumulation of protein is what a cast. And it's kind of long and cylindrical because it was formed in the tubule. Remember the tubule of the nephron. So that's why it has that long cylindrical shape, because it was formed in the tubule. So it kind of takes the shape of the tubule. So that's a Highland cast, and again, there's some other types of casts, but we're not going to get into exactly the difference between the cast here and 110. Also, there's other components that we didn't mention in that previous slide. We have crystals that form in your urine. And these are showing you some calcium oxalate crystals. These look like little diamonds that form or can form in your urine samples. And then here is again another example of a white blood cell. You have a basic round structure and it kind of looks grainy inside. Okay, this image is showing you what a red blood cell looks like. And just think back about the white blood cell we saw on the previous slides and compare the difference between that white blood cell and what this red blood cell looks like. The red blood cell is smooth on the outside and it doesn't have that graininess on the inside like the white blood cell. All these others are also red blood cells on this slide. It's just the ones that are brighter looking are closer in depth on the slide, and these ones that are not looking bright and shiny, they're farther away. They're farther or deeper in the slide. This shininess for these, that's known as refractile. Also something to note, these are also red blood cells, but they have a little bit of a crinkled edge. That means they're crenated, meaning their edge is just crinkled up a little bit. Also, you have some different types of bacteria on the slide. You have a rod-shaped bacteria right there, plus you have some of those little round bacteria known as cocci. The red blood cell is said to have a donut shape. This is known as a biconcave disc. One other thing I want to mention for comparison of the red blood cells versus the white blood cell, the red blood cells are smaller in size versus the white blood cell. Okay, also in the microscopic examination of urine, you can have crystals, and we saw an example of what a calcium oxalate crystal looks like in one of the previous slides, but different varieties of crystals can be present in the urine, and crystal formation is influenced by things like pH of urine, the specific gravity of urine, and also the temperature of urine. The varieties of crystals present in urine can be normal or they can be abnormal. Abnormal crystals are crystals like cholesterol, leucine, tyrosine, bilirubin, things like that. Normal crystals are like the calcium oxalate crystals that look like little diamonds. Some people say they look like envelopes or pyramids that we saw on the image earlier. Also, we have crystals that are known as triple phosphate. They look like little coffin lids. Also, uric acid crystals. Now we just need to cover some definitions associated with urinalysis. First off is cystitis. This is just an inflammation of the urinary bladder, usually from an untreated UTI or urinary tract infection. Urea is where the urine contains white blood cells or pus. This can be a sign of a bacterial infection. Okay, desiccant is up next. A desiccant is used to help absorb moisture. We always have to have a desiccant in the bottle with our test indicator strips for urinalysis. It's important to keep all moisture away from our test indicator strips, because if moisture gets to our indicator strips, it can cause false positives in our urinalysis results. Finally, the last definition we need to be aware of is the refractive index, and this is just the speed of light in air as compared to the speed of light in a solution, and we have to be aware of that when we're looking in the microscope at urinalysis specimens. This is the end of part 2 of the urinalysis lecture. I hope you've learned a lot about urinalysis testing and the microscopic components of urine.